Good afternoon, everyone. This is the second of the post-Hahnemannian miasm lectures. In fact, it's the last one because there are only two post-Hahnemannian miasms, which we have done tuberculinum, and now we're doing the cancer, or sometimes called the cancerinic miasm. Right, so let me share my screen with you. Right, let's start from the PowerPoint here. So today, 20th of April, 2020, and let's move on. Okay, so the first thing is to look at what the definitions of the cancerinic miasm is. And similar to the tubercular miasm, it's considered from the classical point of view also to be a mixed miasm. So it has got aspects of the four foundation miasms, could be incorporated into it, all mixed up together. So we think of the SORA, the psychotic, the syphilitic, and the tuberculinic, any or all of those aspects. It's considered also that at least two of those mixed up aspects in the particular patient, that two of them should be active. So we might see quite strong aspects of the psychotic miasm, the hiding, the growth, the exuberance, and aspects of the tubercular miasm, the hecticness, the time is short, and aspects of it. So here's the main key word that we'll hear a lot of today, and that's suppression, because it's considered to arise from the suppression of these foundation miasms. So suppression is a keynote which we'll see running through the cancer or cancerinic miasm. Looking at the history, the nose-sowed carcinosum was used in probably the mid-1850s and onwards by homeopaths like Compton Burnett and others, but they never spoke specifically about a cancerinic miasm. That was to come later. So there was no formal naming of the cancer miasm, no classification. This happened after the Second World War, post-1945, to British homeopaths Fubista and Templeton. And what did they notice? They noticed, for instance, this was Fubista, that two quite different women who were pregnant mothers, both had breast cancer during their pregnancy. However, both babies, when they were born, had very similar symptoms. So there was a terrible insomnia and crying all night. Now, all babies cry, but some babies cry much more, and it's much more disturbing, and it's really a big issue. The parents can suffer terribly, and of course the baby is suffering through that as well. Also noticed the kind of tics and blinkering of the eyes, and cafe au lait spots all over the body. And I'll give you some examples of this in the next few slides. Many moles over the body as well. So moles are quite interesting because we can also think of them as a type of cancerinic expression. Many moles are benign growth, but we do of course get types of malignant melanomas, which is a type of a mole, and other more slow growing skin cancers. And blue sclera in the eyes. So notice the whites of the eyes had this blue tinge in them. Here's an example of a picture of a baby with the blue sclera eyes. And this is a picture of a cafe au lait spot. So it's a kind of a large, I don't know, sometimes we call it a stain or a port wine stain on the body. But this is not a port wine. This has got a sort of a light brownish color. And they would be found on many parts of the body. So here is an example of I'll show you a short video of the tics, the blinking eyes, the grimaces. Let's have a look at this. Watch the eyes mainly. And the face looks like So there you can see it, that kind of blinking, grimacing. In fact, it's almost like a whole body reaction there. It might not be as strong as that when you see it in a patient. There. So I've got the question, what else about the baby could remind you of the cancer miasm? So this is what Dr. Verbister kind of worked out. And he says that these babies have inherited a cancer miasm. And he decided to treat with the cancer nosode, which in this case is carcinosum. He used the 30Ch potency. And carcinosum is derived from a breast cancer tissue, from this epithelioma, as it is called. And very good results were happened. He achieved good results. And when he noticed these babies, just to be sure that some of them had no history of cancer in their family, but they still showed those, perhaps blue sclera, the crying, the chronic insomnia, the tics, any or all of those, at least, let's say 2 or 3 of those aspects. The cancer miasm is now mainly described in terms of the nosode, and we'll see how this goes on further on. So some of the characteristics of the cancer miasm, let's start on the mental and emotional side. So the key thing, as I've said before, suppression is the keynote. I've obviously looked up in Zulu and I come up with ukucindezela. And what I would like to know from you is what other Zulu words use that same root, and if you can let us know, do these other meanings of the root of the word link into suppression, and how do you see that happening? It's always useful to look at something from a different linguistic perspective. It gives more richness to understanding of the concepts. So the personality is sometimes described as a C type, and I've put a link in there which you can look at. I will add some more memes, whatever, around the idea of the C type. You can also, as a kind of an exercise, have a look at characters you come across in popular culture, in movies, music, TV series, whatever, that you would describe as C-type, and perhaps let's share them. That it'll always be useful to us. It's good to bring things alive by real people as opposed to just notes and descriptions. In the meantime, I'll have a look as well around for that. So they're very nice people. They're eager to please. This ties in with the C-type personality as well. And don't like saying no, find it difficult to say no. So there's the self-denial. And self-denial, we can think of that, again, it's a form of suppression. I'm suppressing myself. Emotionally very sensitive, love, beauty, dance, sea, animals, and humanity. There's a refined personality, and they often deny or hide their own feelings. Carcinosum, natmia, quite a few remedies like that, arsenicum. So we can see another form of suppression. I suppress my feelings. So there is also in the type C personality and in the cancer miasm a tendency to perfectionism and fastidiousness. I want to get it right so that I can't be criticized or called up on it, either criticizing myself or others criticizing me. So here's a more important or very important keywords is the word control. You'll hear the word control a lot when you're mixed up in a patient with a cancer miasm. So there's a need to control my environment and to be in control of myself. Let's look at the fears and anxieties. Carrying on. Anticipatory anxieties are very important. And here's a rubric: mind, fear, something will happen. A big rubric with 276 remedies in it, but I've put in some of the top 6 over there. There's, of course, plenty more, and carcinosum, arsenicum, and many of the other cancerinic remedies will come up there. Another rubric, getting more specific, is something will happen to him or his family. So here we see carcinosum comes up as number 1. Arsenicum is there, calc sulf, cathartes aura, which is a bird remedy. It's a type of condor, an Andean condor. Fear of diseases, and not surprisingly, cancer is one of the main diseases that is feared, and we see this in these cancerinic remedies like arsenicum album, nitricum acidum, organtum nitricum. Heights and narrow spaces, and this is very common in the mineral kingdom and especially in the gold series. So you can ask patients about their fears and anxieties, and they might not come up quite quickly, but you might say, how do you feel about going to a high place? Now, all of us can feel a little bit of danger at a high place, but they might say it in a lot more strong terms, like, no, I can't stand to be in a top building. I have a horrible feeling there. I feel it terribly in my stomach. I feel I might jump or I might fall. And for narrow spaces, they might say that they don't like a crowded lift or a narrow tunnel or something like that. Let's look at some of the physical and clinical indicators. And there's a lot of things that are very strange that happen around childhood illnesses. And one of them is that often these childhood illnesses happen after puberty. In other words, they don't happen in childhood at all. They happen after the patient has been 12 or 13 years old. So a person who gets chickenpox at 18 years old, or mumps when they're 20 or 22, that's unusual. That's a PQRS symptom that could perhaps tie into the cancer miasm. So also complications, many complications during childhood illnesses. So normally mumps is not such a bad disease. It's the swollen glands around the neck and in the mouth area. But orchitis, this is this inflammation of the testicles. This is a more severe manifestation and more uncommon during mumps. Or that they have no childhood illnesses experienced at all. And this in a way ties into that keynote of suppression. It's almost like physically their vital force has suppressed or prevented them from having a childhood illness. They don't want to have it. It's inconvenient. It's out of control, whatever it is, at a very deep level. This is not a conscious thing. This is from the very deep, unconscious, automatic parts or autonomic operations of the vital force. Never well since syndrome is important. And here we often hear of a person who's had glandular fever, mononucleosis, and since they've had that, they've never had a good recovery. Or sometimes it moves into a chronic fatigue syndrome or a post-viral syndrome. So never well since, it could be never well since a trauma, never well since quite a few other things, some major event in their life, either physical, emotional, or something that has hit them. We could also need to look at those Furbister indicators that we've described earlier, that insomnia, crying baby syndrome, cafe au lait spots, the blue sclera in the eyes, and tics and blinking of the eyes. Quite interesting as well is one might find the family history of somebody who needs miasmatic care in the cancer miasm is a family history of diabetes, the cancer, or tuberculosis. So let's look at what might cause the cancer miasm. So it could obviously be acquired, or it can be inherited. We saw in the case of the babies born to the mothers with breast cancer, that's a case of inheritance. But here there's some cases where it's acquired. It's from events and circumstances in the life of the patient. So a history of suffering and trauma and very much so with suppression. You cannot talk about these, what you've gone through. It's difficult to talk about that. So ailments of domination, from domination, these are also important rubrics in the mind section of the repertory. Here we're looking at the complete repertory, and we find mind domination by others aggravate, and it's got 63. So we've got tuberculinum, lacleolinum, let's see what we've got, aurum, muonat, carcinosum. There's quite a few there. And looking at Murphy's repertory, mind dominations by others, ailments from, now specifically children in, now carcinosum moves up to a higher grade here, with lycopodium and very important staphysagria. Staphysagria is a very important cancerinic remedy as well, as anacardium we see down the line there as well. Natmur as well. Natmur, that's suppression of feelings, suppression of self. And unfortunately, we do come across patients who've had ailments from abuse, could be sexual abuse as a child often, and carcinosum, staphysagria come up here. Folliculinum, you'll see the FOLL, and that is very much related to carcinosum. Lac-C, the lacninum, the remedy from the milk of an abused dog. So in other words, been made to be dirty, abused, like a dog. Got Medurinum sepia. So these type of etiologies, the history of suffering and trauma, the ailments from domination, especially as a child, will give you a strong out of control feeling. And they might describe the opposite of control as chaos or chaotic. And this might leave them overwhelmed. These are very common terms that you're going to pick up in the cancer miasm. So here's just a large group of cancer miasm remedies. The first group drawn from the mineral kingdom. What you can see is most of the arsenates are there: aurum arsenate, arsenicum album, baryta arsenicosa, cadmium arsenicosa. Those are very important. Quite a few nitricums will come up there: baryta nitrica, cadmium nitrica, argentum nitricum, nitricum acidum. Okay. From the plant kingdom, here are cancerinic remedies as well from the cancer miasm. Agaricus, the mushroom, anacardium, the remedy from the Anacardiaceae family, Bellus perennis from the Asteraceae, conium, very important to some glance through, Ignatia from the Loganaceae, opium from the Papaver. Phytolacca is often used as a clinical remedy for treating breast cancer. And yeah, let's carry on. From the animal kingdom, less remedies here that are identified. Aramacau is a hawk, sorry, it's not a hawk, it is a type of toucan, a type of parrot from South America. Butia jamaicensis is a hawk, the red-tailed hawk. Corvax corax is the raven. Cygnus cygnus, the swan. Aleatus leucocapitis is the bald eagle. And obviously the nosodes, carcinosum and serinum. The serinum over there, the SC, is also derived from an epithelial, but it's probably one which has got very hard scar-like tissue formed during the development of the cancer. Let's look at the clinical uses, how we would actually decide when to use it, the cancer nosode carcinosum. Firstly, for the totality of symptoms. So if you take a case and so much points to carcinosum, as we've described earlier, then that should be prescribed, and prescribed in the potency you think seems fit. It may be a current totality, or you might find that it's a constitutional symptom that sticks. So it could occur on the first consultation, and that is often because the patient is on guard and wants to portray that everything is more or less okay with them, and they don't want to, they find it difficult to show. They suppress their mental and emotional symptoms, and they seem more focused on the physical issues. They try to portray a more positive aspect of themselves and of their life. So carcinosum in that case could open up the case for other remedies, which are more kind of constitutional or more pointing towards the person's personality in the follow-ups. Could be used multiple times as well, where you, even in the follow-up, you still see these aspects of carcinosum, the around the nosode itself, severe insomnia, the self-denial, and a variety of other symptoms that might come up. It could be an intercurrent remedy, and that is where it's not clear, it's difficult to prescribe, you don't know. So, and that again is where the patient finds it difficult to express and to kind of give you a portrayal of what remedy they actually need. It might also be a case as an intercurrent where you give quite a well indicated remedy, it doesn't seem to work, or it works for a couple of days or a week or two and then stops, and despite repeating it, it doesn't work again. Now, just a caution of yet, don't use it automatically when the patient has cancer. It's not the first thing one should think of. There's quite a few cases where it's not going to help. You really need to prescribe some other remedy or group of remedies. In the cases of frank cancer, so you only prescribe carcinosum if it is indicated. So let's look at a summary of the cancer miasm. Very nice people, kind, considerate, sweet people, want to be of service to humanity. They are sympathetic and compassionate patients, yet they're always holding back their emotions, the trauma they've experienced, and perhaps the anger that results from their life experience. Staphysagria is a classic remedy in that regard. In other words, it's suppression of the person's emotional life. There's a lot of anger there, but they cannot show it. They feel it's problematic to show it, or they just have great difficulty in showing it. So there's also that need to be in control. And this is maybe particularly where they've had past traumas. So you've just given a situation at a young age, say growing up with a drunken, abusive father, there's nothing you can do about it. You are out of control. So as the patient grows up, now they say they never want to be in an out of control situation again. They've had it once before, and everything they're going to aim at now is to maximize and ensure control in their lives. The feeling is if there's no control, then there can be chaos. Can sometimes be difficult to prescribe because, as we said earlier, there's the suppression of emotional and mental symptoms. The patient is often holding back. Chronic insomnia is very important, and it's almost a keynote. Because you can imagine that as a form of suppression as well, not wanting to let go into the sleep, into the unknown, into the depth of the unconsciousness that sleep brings about. The immune system is often compromised, thinking at a physical level, so we can think about post-viral symptoms and others. And as we spoke about earlier, this family history of cancer, diabetes, TB, and the other physical indicators that for Buster. Okay, thank you very much. I think that covers it, and please be in contact. Let me know what's happening and how things are going and how you are managing to receive this. Stop that share. Great, I'll post this up and you will see it obviously from a link.